Good afternoon, one and all. Today is the fourth day of International Breastfeeding Week 2023. Myself, Nikita Zaibai, I would like to introduce today's speaker, Rajee Elizabeth Varghese. Ma'am has mastered in nursing from Bangalore. She has a charge nurse, labor and delivery, and women's wellness and research center. Ma'am has 1 year clinical experience, 2 years as nurse educator, and 3 years in teaching experience. Ma'am has proficient in conducting deliveries and managing the complications during deliveries and newborn resuscitation. Ma'am has awarded Best Academic Performer, Best Nurse, and Dedicated Nurse. Ma'am has quality project member in 2022 to 2023, and ma'am has membered in TNAI SOMI FINQ, and ma'am has excellent computer skill and leadership, and she can do teamwork.
Good morning, everyone. Myself, Rajee, an alumni of BVDUCON Pune, currently working as a partner in labor room in WWRC, that is Women's Wellness and Research Center in Medcare Corporation, Quatar. I am so grateful to the Chancellor, Vice Chancellor, our Principal Ma'am, Vice Principal Ma'am, and all of the BVDUCON faculty for providing me an opportunity in this international webinar on the occasion of the Breastfeeding Week 2026. We all know that breastfeeding is one of the most important and the precious things for the mother and the baby. So, what is breastfeeding and what are the challenges it is facing by the mother during the breastfeeding that we will see today? Breastfeeding is a journey with so many ups and downs. During those first few days and weeks, it may feel like there are more downs than the ups. It will get easier with time and practice. Continuing to breastfeeding after returning to work is a serious issue for the new mother. The benefits of breastfeeding for the first 6 to 12 months of life are established, yet most breastfeeding mothers deem their incomes when they return to work. Maintaining breastfeeding after return to work is challenging for the working mother, and majority of them need support to continue with the breastfeeding practice. Even though the breast milk was the best for the baby, when it came to work, the size of dose affects the practice of breastfeeding. The challenges of breastfeeding. All mothers face facing one or the other breastfeeding issues during the starting phase of the breastfeeding. First, we will see some of the common breastfeeding challenges which we are facing by all of the breastfeeding mothers, and then we will go into the challenges facing by the working mothers. So, some of the common breastfeeding challenges were the sore nipples, the low milk supply of the mother, the cluster feeding and the growth spurt, the breast engorgement, the flush duct, the fungus infection, the size and the shape of the breast as well as the nipple, the method of exposure, and the feeding life. The mother can't leave the baby when they are going for work, the feeling of sadness and depression, and the lack of the support. These all are the common points which we all know and which we all have learned and we all are going through. So, we will see what all are the common breastfeeding challenges with the working mother. First one, the mother's perception, the pain during the breastfeeding after returning from work, the socio-cultural pressure to introduce the artificial feed, the insufficient breastfeeding support from the society and the healthcare providers, short maternity leave and the workforce. These are all some of the common challenges which is facing by the working mother. So we will see one by one. Mother's pressure. Some of the mothers may have some perceptions like feeling that their milk was insufficient, feeling too much time to breastfeed, especially in the public, finding the breastfeeding difficult and inconvenient, and failing to breastfeed after twice. So these are some of the difficulties which are facing by the mothers whether they are thinking that their breast milk is very insufficient for their baby and they have too much time for breastfeeding the babies when they are outside their home. And regarding most of the important things is the failure to breastfeed even after they are outside. So the working mothers may feel that their milk was inadequate once they have returned to work. Some of the mothers feel that the breast did not produce the milk anymore as a result of being away from her baby. They may also have the belief that the breast milk alone is not sufficient in meeting the nutritional needs of her baby. These are the main reasons for using the formula milk for the baby because they are planning to return to work. This is then resulting in confusion for the infant and affects the breastfeeding factor. So this is because of the mother's perception, misperception that there are chances for starting after formula food for the baby and as a result of that there may be difficulty in finding the normal breastfeeding factor and it will be a problem for the mothers when they are going through the work. The other problem is the pain during breastfeeding after returning from work. The breastfeeding mothers who are working are experiencing the discomfort and pain during and after returning from work due to the accumulation of the breast milk. Because when the mothers, the breastfeeding mothers, when they are working, they may not be getting the time for the expression of breast milk when they are working. So because of that, the breast milk will be accumulating in their breast and it will be very inconvenient and painful for the mother. The mother should begin pumping the milk approximately 2 weeks before she returns to work. This gives her a chance to practice with the pump and help to build her supply. So many of the mothers may not be knowing regarding the expression and the storage of the breast. So we should give the proper health education for this working mothers before they are returning back to work. So that at least before 2 weeks returning to work, so they can start with this expression of breast milk and it will help to build a confidence in the mothers to do this expression of breast milk as well as to increase the breast milk supply of the mother. Some mothers are not getting sufficient time for expression of breast milk due to their busy schedules or lack of knowledge regarding the expression of breast milk. And many women feel guilty for taking extra breaks to pump. If these mothers are not able to pump as often as necessary, it is likely that their milk supply will begin. So many of the mothers they may not be knowing after discussing about they may not be knowing more things regarding the expression of breast milk as well as the storage or they may not be getting enough time or the ample time for the expression of breast milk due to their busy duty schedule. So for these mothers, they should be educated properly. They should be considered as they are the working mothers because they need to consider both the mother as well as the baby. So if we are considering and educating them properly, this pain during the breastfeeding, we can reduce it and it will be helpful for both the mother and the baby. And because if it is if we are not able to express the breast milk even after returning from the work, in the home they will not be able to feed the baby because of the pain. Okay? So the expression of the breast milk it is one of the best ways to reduce this pain during the breastfeeding. Next factor is the socio-cultural pressure to introduce the artificial food. The top most challenge of the exclusive breastfeeding practice is the belief that the breast milk alone is not sufficient in meeting the nutritional needs of the baby. We all know that many of the mothers are thinking that whether the breast milk is really sufficient for my baby, whether the baby is whether the baby is gaining weight. So these are all the thoughts which will be coming in the mother's mind. And especially when they are returning back to work, it will be increased. That means I will be away from the baby for some time, so my baby will not be getting. So this type of thinking, it will affect the breastfeeding factor. It will affect the hormonal supply. It will affect the milk supply of the mother. Okay, so some of these things, it will informs the mother to start with the infant formula for the baby. And during the birth time, if the employer is not supportive for the mother, breastfeeding at work, it is likely to be unsuccessful. Therefore, the mothers are forced to give artificial feed to the baby. So, from the organization, the employer is having an equal responsibility for this breastfeeding mothers. So, because they have to provide some extra time to these mothers for the expression of the breast. Insufficient breastfeeding support from the society and the healthcare provider. The support from the spouse and the family members influences the working mother's decision to breastfeed is one of the major factors which will affect the mental stability of the feeding mother, because if there is no proper support from the spouse as well as the family members, the mother won't be able to do. She will be in a confusion that whether I have to continue to work or whether I have to continue to take care of the baby. So, the family plays an important role in the care of the baby in the absence of the mother. Yes. Employers also play a vital role in providing a support system and the facilities in the workplace for the mothers to express and store breast milk. Because in the organization, the mothers should be having a separate area for the expression of breast milk, as well as they should have at the facilities like the refrigerator for the storage of breast milk or something like that. They have to provide. Generally, the mother will be getting motivated to do the expression of breast milk. Both the internal and the external support are essential for the mothers to overcome the challenges in order to achieve success in breastfeeding. So, if they are getting a proper support from both the family members, the spouse, and from the employer, the mothers, of course, they will be like successful in maintaining this healthy breastfeeding for the baby. The organization should provide the facilities for the working mothers like feeding rooms for expression of breast milk, ample time to express the milk, and facility for the storage of breast milk. The lack of special facilities such as baptism room leads to the early introduction of the formula. The short maternity leave. Maternity leave, it is the right of every working mother. The length of the maternity leave depends upon the organizational policy. Yeah. Because the length of the maternity leave is like for different organizations it will be different. For example, I am working in a Hamad Medical Corporation. We are getting only 60 days of maternity leave, whereas in India you can see that the mothers are getting 6 months of maternity leave so that they can continue the exclusive breastfeeding, for example, for the 6 months period. But here, all the working mothers, we are facing the problem of this exclusive breastfeeding because we have to return back to work immediately after the 60 days of post-delivery date, and along with that, we have to do all the 6 weeks. So, it is available from 2 months to 6 months post-delivery. So, the mental and the physical challenges of the mother will be different based on the length of the maternity leave. The breastfeeding pattern of the mother joining on the 3rd month post-delivery is different than the mother who is joining after 6 months post-delivery. So, of course, the mentality of the mother will be entirely different because immediately after 2 months, returning back to work means it is really a challenging factor for the mother because they have to leave the baby, and that is the important time period for the baby, which means the exclusive breastfeeding for the baby, and it will be really a challenging factor for the mother as well as the baby. Some research studies show that the mother who works in an organization that offers a 6-month maternity leave express a positive experience of breastfeeding habits, feeling better and happy. They also express that their children are happier and happier, of course, because we know the importance of breastfeeding, we know the benefits of breastfeeding. So, of course, the baby who receives the 6 months of exclusive breastfeeding will be more happier, more healthier, and more attentive than the baby who receives the breastfeeding exclusively for a period of 2 months. But still, even though it is a 2 months maternity period, the mother can still continue the exclusive breastfeeding because we have the mothers who are having a For example, in Hamad Medical Corporation, we are having too much mechanical issues, but after that, we are providing 1 hour of the feeding hour. That is either like coming for the shift, they can take 1 hour, or before going to the shift, 1 hour they can take as a feeding hour. And also in between, they can take the break for the expression of the breast milk, and we are providing the storage area also for the excess breast milk for the mother. So we have the mothers who are continuing this duty breastfeeding for a period of 6 months, and we are also happy for that. The work pressure, the another major important factor which affects the breastfeeding. The employment issues such as the work skills facilities and the working hours affect the practice of breastfeeding. Having a job with flexible hours and an environment that supports breastfeeding influences the mother's perception and the factor. The flexible hours in the sense, I mean, like for example, in our hospital, it is like we have shift duties and we have fixed time duties also. So the mothers who are coming for a fixed time duties, that is from morning 6 o'clock to 2 p.m. duty means they have a fixed duty schedule, and they can go back to home after 2 o'clock and they can do with the baby. But some like other mothers, we after example like in labor room, we have shift duties, so we are coming for the 3 shift duties like morning, evening, and night shift. So the entire breastfeeding pattern for the mother as soon as the baby is changing. So the working mothers with the different shift pattern affect the breastfeeding routine of the mother and the baby. The feeding mother should be provided the flexible duty as per the organization. So how we can help these mothers? Like these all are the challenges which are facing by the working mothers. So what is the solution for this? The expression of the breast milk. This is the one of the main and major and foremost important things and the solution for the challenges which is facing by the working mothers. Expression of breast milk. Expression of breast milk by hand is an important skill for a lactation woman. Expressing breast milk in the breastfeed to help the working mothers to maintain the optimal milk supply after they return to work and feed their child for a long period. Through efficient emptying of the breast and increased prolactin level, and it will in turn lead to the great breast volume. So that means that this expressing the breast milk, it helps the mothers in so many ways. That means that it helps her to maintain her milk supply. That means that every hour or 2 hours or 3 hours when we are removing the breast milk, the same amount of breast milk will be produced in the mother's breast. And the breast milk which is collected, which we can store it in the refrigerator. And once we see returning back to home, she can feed either she can feed through her breast, or she can feed the excess breast milk, or she can continue store that breast milk. Okay, so this is one of the main things and the important thing which helps the mothers in facing the problem. And there are 3 ways to express the breast milk. We know that. That is manually, that is by the hand manually, with a manual breast pump, with an electric breast pump. So I am talking about my organization. Here in our organization, we are getting the support for this breastfeeding, and we are getting the electric pump for the expression of the breast milk. And during the postnatal period, in the postnatal ward, we are getting a health education for the mothers regarding the expression of the breast milk, even in the initial period of breastfeeding. That is, even in starting from the first month onwards, we are educating the mothers to express the breast milk and to store the breast milk, because we don't know what time, any emergency or anything when the mother is getting separated from the baby. We can use to store the breast milk, and all the teachings like how to store breast milk, how to use to store the breast milk, everything we are giving the education. So same like that, if we are providing a proper health education to the mother and along the family members, because the spouse also will be an important part for the expression of the breast milk. So if you are providing proper education, means it will be very help for the mother as well as the baby, and the baby very healthy. So working mothers, they need the support from the spouse the families, the friends, the employers, and the healthcare staff. So we need all the members. We are playing a very important role in the breastfeeding practices because if the spouse, if it is not helping or cooperating with her, then enter the physical and the mental stress will be increasing. Will affect the breastfeeding as well. The friends, the employers, and the healthcare staff all are playing a vital role in the breastfeeding. Simple and user-friendly breastfeeding education program will help the working mothers to overcome their breastfeeding issues and challenges. The working mothers have difficulties to enhance knowledge regarding breastfeeding due to their time limitations and work commitments. Those mothers need persistent motivation related to the breastfeeding because many of the mothers, like we know that when we are going, because we were the nurses during our student period and when we are going and trying to educate the mothers, they will just listen to us. But they may not be there with that complete listening, they will not understand many of the things. So those limitations and the time limitations also affect the breastfeeding as well. But exactly when they are coming into that situation, of course, they will be having that mentality to listen to all these things. So they need the education during that time. Information on the causes of breastfeeding challenges and how to overcome them is crucial to prevent the mother from thinking that the breastfeeding is difficult, especially when they return to work. So even after coming back to work, the breastfeeding is possible and the exclusive breastfeeding is completely possible because we are the working mothers. We are going through that phases and we are succeeded in those things. So these challenges all can be overcome through this exclusive breastfeeding. So, thank you so much. And again, I am thanking to the organization, to the principal ma'am, vice principal ma'am, and for inviting me and providing me a chance to present the challenges of the working mothers regarding the breastfeeding. Thank you so much.
Thank you, ma'am, for sharing your valuable words about motherhood challenging in breastfeeding. I would like to introduce our next speaker, Dr. K. Memchoubi. Ma'am is qualified PhD holder in nursing. Madam is currently working as assistant professor at Bharati Vidyapeeth College of Nursing, Pune. Ma'am has total 19-year experience in this profession. Ma'am has professional skill in clinical area, teaching research, and researcher and research guide. Ma'am has also research guide of UG and PG student. Ma'am has 28 research product conducted. 25 research articles are published, and at the national level and international level, 5 scientific papers were presented and contributed in publication of 2 books. Ma'am received Master Award. She is a Vice President of TNAI in Pune City branch. And then she has also Master Trainer of IMNCI and NRP. She has also in the University of Health Science West Bengal. She has adjudicator dissertation. She has also university examiner for UG and PG program. Okay, over to you, ma'am.
Good afternoon to all. Today we are going to discuss on the motherhood challenges about the breastfeeding, which are experienced by the unemployed mother. You have already heard about the employed mother. What are the challenges faced by the mothers regarding breastfeeding? So when we talk about the unemployed mother, this is one area where we always assume that unemployed mother may not have or may not face any challenges about the breastfeeding, as we always feel that they are at home and they are able to take care of their babies. But yes, unemployed mother do face some challenges on breastfeeding. So this is what we are going to discuss today in the this international webinar. So the topic given to me for this is motherhood challenges breastfeeding for unemployed mother. So, as an introduction, I would say that motivation is always a key to successful breastfeeding. But yes, it is so important to understand the challenges and be prepared to deal with those. So, knowing what to do moving forward helps significantly. So, though it is natural, breastfeeding is not without its challenges, be an employed or unemployed mother. So, there are always some challenges faced by the mother during breastfeeding, whether the mother is employed or unemployed. So, breastfeeding practices, if we see this, very greatly influenced by the mother's attitude towards and knowledge of the breastfeeding. So, these are the two main factors which is going to influence the breastfeeding practice, that is the attitude and knowledge of the mother towards the breastfeeding. So, let us just see some reviews how the mother faces challenges on breastfeeding. The first review is review one. So in this, we'll see a survey done by Miss Bindu Sargent Perapadan, that is on breastfeeding challenges. In her survey, it reveals that it is a very tough and breastfeeding journey by the new mothers, especially the mothers who are breastfeeding for the first time. That is especially the primipara mother, they usually say that in this survey, breastfeeding is a very tough and difficult journey. So, the top six breastfeeding challenges faced by the Indian mothers in this review, you can see the early day challenges such as the sore and cracked nipples, latching problem, and goat's breast. That is about 34.7% of them. They face the problem of sore and cracked nipples, latching problem, and goat's breast. Even 31.8% of them they face the exhaustion from waking up in the middle of the night, too many feeding sessions and long feeding sessions. And about 26.61% of them they faced a problem of baby biting, and around 22.7% of them they face a problem of lactation issues. Even problems with breastfeeding in public, including even lack of facilities and even the restrictions of the area, and some of them around 17.42% face the problem of postpartum depression. Whether the woman is employed or unemployed, these are some of the challenges usually faced by the mother, especially a new mother. So this is the first review. In the second review, we'll see about the knowledge of a breastfeeding practices among mothers attending a tertiary care setting in East India. So in this review, it says that 66 of the mother have heard the word exclusive breastfeeding. So 66% means not even, it means just above the half of the mother which was undergone this research. So out of the 66 of them have just heard about the exclusive breastfeeding. Only 9% learned through the media, whereas 29% of them and 62% of them learn it from family members and healthcare personnel, respectively. So, unexpectedly, if we see only 23% of them were aware that breastfeeding needs to be started as soon as the baby is born. And even 67% of mothers did not know what colostrum was. So, this is also one area where we need to explore a lot. A lot. Mother doesn't know what colostrum was. 39% of mothers said colostrum ought to be thrown away. So 20% of the mother were aware of the prelactal feeds, and honey was most common prelactal feed used. 54% of the mothers were unsure if breastfeeding was good for the mother and the baby, and only 9% of the mothers were aware of the duration of prolonged breastfeeding, while 53% were ignorant of the same. So, after seeing this review, we come to know that knowledge is one factor or one challenge where most of the mothers are lacking about the breastfeeding practices. So that means only 66 mother heard about the exclusive breastfeeding, and which is a very important practice that every mother should practice the exclusive breastfeeding till 6 months. But out of those mother, only 66 of them know about the exclusive breastfeeding. And one most important, that is about the colostrum. You can see here only 67 of them know about the colostrum, and 39% of them always throw it away the colostrum. So which is the most important first feed of the mother that will help, first feed of the baby, that is going to help in improvement of the immune system of the baby. So these are the areas where the mothers are lacking to know. So knowledge is again one challenges which we can see. Review 3 in this heard, that is one of the expertise, She has done a survey among the mothers about the breastfeeding again. So, in her survey, she could find out five common challenges that might face while trying to breastfeed, which includes the first one is new mother anxiety. Yes, always the first mother or woman who has become mother for the first time or breastfeeding for the first time, they usually have a feeling of fear about the breastfeeding. So, a mom wants to do the best for her baby, but there's often a fear she may not adequately feed the baby since she can't see how much the infant is eating. So she says this is one of the most common mental challenges a mom might face. So Hurt explains there's a misperception that babies need a big bottle. So this is again one misperception usually the mother has that baby will need more, and that is one anxiety that usually they have. Second one is feelings of deficiency. So if a mother's milk is not coming in right away, many moms feel their bodies are deficient and not working properly to produce milk for their baby. Usually this occurs among the new mothers when the first few days, first, second, third day after delivery of the baby, usually the amount of the milk is very less and they usually feel that it is less for the baby. So that is one feeling that usually they have, that is feelings of deficiency. Next is the sore nipples, where unfortunately uncomfortable, painful, and frustrating. Many women get sore nipples from the breastfeeding. So again, this is one where they usually avoid giving breastfeeding because of sore nipples. The fourth one is the work. New moms may have to learn to juggle work and the need to breastfeed. By law, work environments are required to have a space where mothers can pump their breastfeed. So this year it is talking about really about the working women. Even for the unemployed women also, they need to adjust with the household chores. So again, this is one challenge usually they face, how to adjust with the household chores and how to breastfeed the baby time to time. Next is the desire to use formula. So while it's common perception that women can breastfeed and use formula to bottle feed their babies, Hart says this may not be the best route if a mother wishes to continue breastfeeding for a full year or more. So even though they have a desire to use formula, again, it needs to understand by the mother uh, how the breastfeeding has to be done until what time it can be continued, which is good for their baby. So as the literature says that the mother can continue breastfeed their baby till 2 years, even it can continue till 5 years. This is the recent literature which says for how long a mother can continue to breastfeed their baby. So these are the five challenges we can say was that described by the next. Again, in the next review, uh, which was a survey was done by Antara Rai Chaudhary and Aditi Suri. In this, factors, or you can say the two challenges, usually was revealed in this survey, that is financial challenges and social barriers that makes a breastfeeding tough for women engaged in India's informal economy. That was given by the Antara Rai Chaudhary and Aditi Suri. So in their review, a case study was done of a woman who is 24-year-old. Her name is Kavita, who is a home-based worker. She makes toran, that is a decorative wall hangings, for a living. She lives in a North Delhi settlement, working 8 hours a day for a daily profit of 30 to 50 rupees. But the problem that she faced after the birth of the second child, that is given in this case study, a tall, streetwise, and seemingly nervous woman, she is Kavita, had to give up a housekeeping job that paid her more than twice her current income because of her childcare responsibility. Even she is the primary caregiver for her 4-year-old child and a 3-month-old baby, and also the primary earner in her house is because her husband is a rickshaw driver and has not held a sufficient salary per month, forcing her to juggle responsibility for the house responsibility, taking care of the babies, as well as even the she has to continue working for less amount. So Kavita's precarious working conditions limit her ability to exclusively breastfeed her infant for 6 months. That means when we ask, that means that these two expertise, when they ask Kavita if she believed 3 months of exclusive breastfeeding was enough for her infant, the answer that she gave was, I managed to do it for 3 months, but I will not be able to do it for 6 months, as one must, she said. I have to step out to get a job that pays well, and it is unthinkable for me to take my 3-month-old child to work with me. So she understands the importance of breastfeeding, that it has to continue at least for 6 months exclusive breastfeeding. But because of her condition, as she has to go out and earn the money, or she is one of the important breadwinner of the family, that she feels that it will not be possible for her to continue for 6 months. At least for 3 months, she managed to do it. That was the answer given by her. So Kavita's dilemma is shared by a majority of working mothers in India. They are unable to exclusively breastfeed their infants, though they unhappily uh, it is important concluded an exploratory research conducted by the Indian Institute of Human Research by in the Bangalore. So this is one of the case study which is very important, how the mother who is earning for their livelihood, who is a breadwinner in the family, how what challenges they have to face while breastfeeding their baby. Next, in the review 5, this is one of the study which was done in one of the developing country, that is Ethiopia. It is actually comparative cross-sectional study between the employed and the unemployed mothers on the exclusive breastfeeding practice and its associated factors. So in this 64.7% and 75.4% prevalence of exclusive breastfeeding practices among employed and unemployed mothers, respectively, in the 24th preceding the survey. So other factors associated with exclusive breastfeeding that is practice included being unemployed mother, larger to normal birth weight, infant age 0 to 3 month old, infant being male, have radio in the house, infant being unwanted, delivery by non-cesarean section mode, and presence of ANC follow-up during pregnancy were found to be significantly associated with exclusive breastfeeding. So this was concluded that the prevalence of exclusive breastfeeding practices was uh, among employed mothers was significantly lower than that of the unemployed mothers. So with all this review, we can conclude that say as very less and no review related to the challenges faced by the unemployed mother or breastfeeding are there. If you see, most of the reviews are either a comparison between the employed and unemployed mother, or the reviews are mainly based on the among the employed mother. But for the unemployed mothers, there are very less, or we can say no reviews are available. So with all these reviews, I can just conclude that the challenges faced by the mother, whether the mother is employed or unemployed, are first one is the lack of knowledge, because they need to improve her knowledge about the exclusive breastfeeding, about the continuation of breastfeeding, even the time factor that they are not able to give to their babies for breastfeeding to continue for the exclusive breastfeeding, and the fears usually which are faced by the new mother, the anxiety usually they face, and the environment where the breastfeeding has to be given, usually they need a privacy for the mother to breastfeed their baby. That is again one challenges we can say the faced by the mother. And the option of formula feeding, when it is available, usually sometimes they try to switch on the formula feeding. And physical complications like sore nipples, breast engorgement, biting, these are some of the physical complications usually faced by the mother and try to avoid the breastfeeding. So we can conclude that these are some of the challenges faced by the mother, whether employed or unemployed, on breastfeeding. Thank you.
Thank you, ma'am, for sharing of your valuable words on breastfeeding week for unemployed mothers. I would like to introduce next speaker, Miss Sneha Sankpal. She holds a degree of Masters in Child Health Nursing. She is working as clinical instructor in Bharati Vidyapeeth deemed to be University College of Nursing, Pune. Ma'am has total 5 years experience in this profession. She has published 5 research. Ma'am has contributed in state, national, and international workshop and conferences. Ma'am has received award in masters. She is executive member of TNAI Pune branch, and ma'am is a committee member of research cell of Bharati Vidyapeeth College of Nursing Pune. Ma'am has a research guide and UG and PG students.
Good afternoon, one and all. Today we are going to see motherhood challenges of employed mother. So we'll see in detail about case scenario of motherhood challenges of employed mothers. Name of the mother ABC. She is 30 years old female. Her child is 7 month old. She is an employed woman. So the challenges faced by her. I have taken an interview of the mother and she has given her opinion. In morning, all the household work I have to complete alone. It may of child or other family members. Breast milk expression at workplace. She is facing difficulty to express breast milk during working hours due to inappropriate lactation room. She is feeling guilty. She feels guilty about not being able to spend time with her child, especially during early years, and missing out on many moments of mothering. The guilt of leaving the child behind. Inconvenient time. Frequent interruption from calls about their children can make it challenging for working mothers to maintain focus on their task at the office, potentially impacting their job performance. Next, finding a balance between work and family. As a working mother, she is struggling to balance between work and home. It becomes more challenging with children or long and irregular working hours. Lack of emotional support. As she is not getting support from her family members, the struggle of finding quality care. Finding quality child care that is affordable and convenient can be a challenge faced by her. It can add to the hardship in areas with a shortage of children or childcare option. Taking leaves for children. A child health is the topmost priority for her. As she is working, taking a leave for her can be a difficult decision. On the one hand, she is responsible for her child health, and other on the other hand, she may face obligated to do her job. She is facing difficulty in making choices. As a mother, choosing between work and child is the most difficult task. This daily sorting of priorities can make life tough for even the best time manager. It is important for employers to support struggling mothers and provide them with the resources and flexibility they need to be successful in both their professional and personal lives. Next, she is having stress as she has she is having responsibility of work, home and child can lead to stress. Next, she is facing the coping with the emotional demand. Being a working mother can be emotionally draining as they may feel pulled in different directions with struggling to meet the needs of both work and family. For a mother, it is a very difficult to focus on work and leaving her child at home. She is tired because feeling physically and emotionally overwhelmed by parenting. Self time. As a working mother, she is not getting uh, time to spend on some time on her due to hectic schedule. So here I am concluding the today's session. Here are the some tips to help working mothers find a balance between work and childcare and overcome some challenges they may face. So seek support from your colleagues, family and friends. Plan and organize your home and office work. Find a flexible work arrangement. Discuss your needs with your employer and do not hard press yourself. Thank you so much.
Thank you, ma'am, for sharing your case scenario on working mothers. I would like to introduce our next speaker, Miss Rucha Bade. Ma'am is Masters in Child Health Nursing. She is working as clinical instructor at Bharati Vidyapeeth College of Nursing, Pune. Ma'am has 2 year experience in this profession. Ma'am has published research at national level. She has organized various workshops and webinars. Currently, she is working on two projects. Ma'am is a member of TNI and alumni of Bharati Vidyapeeth. Ma'am has excellent skill working with team, having leadership quality and can work as counselor.
Good afternoon to one and all. Today we are going to see the motherhood challenges of unemployed mothers. Case scenario for it. Name of the mother, Mrs. XYZ. She is 25 years old female. Her child is 1 year old. She is an unemployed woman, so the challenges faced by her. I have taken an interview of the mother and she has given her opinion that all the household work I have to carry alone, it may be of child or other family members. I cannot eat my choice of food. Food has to prepare by myself, so I was not able to feed the child at a proper time with a normal way. If I face any problem, I used to search on Google to clarify my doubts instead of asking to family members. I am living with a joint family, so I was not getting a privacy to feed the child. Most of the time, the relatives and visitors are coming at home to see the baby, so I was not able to get enough sleep. Due to family death, she went into the stress, which was affected to her health. As husband was working, at night she has to look after the child. So she was suffering with headache, not having a proper sleep, not getting a proper food at right time. So here is the conclusion. Whatever the mother was facing the challenges during the postnatal phase, mother need plenty of rest, good nutrition, respect, appreciation, safety, family unity and love. Other family members can help the mother to carry daily activities, so she will get the rest. Choice of food should be preferably given to the mother, excluding junk food, by providing proper knowledge to the mother and family members. Instead of preparing the self food, family members can cook for at least few months for the mother to promote her for more breastfeeding supply. Listen the mother carefully by keeping the patience, give the proper solution by telling scientific reason to the mother. Joint family can provide a best support to the mother by all the means, by sharing feelings, exchanging ideas, providing psychological support. Sometimes mother has to feed the child, so privacy should be maintained. Family can give the positive environment to the mother, which is more essential aspect for the mother. Relatives can give some space to the mother to cope up with every situation, so the mother will not be in a stress, because more stress may lead to the less breastfeeding supply. Mother needs more psychological support in this phase. If she will take a stress, it will directly hamper on milk supply to the child, as it is a special and unique way to feel connected with the baby, which increase physical and emotional bonding, which helps reduce a social and behavioral problems in both child and adult phase. A mother hugging and talking to the child is most essential for the breastfeeding, which makes a child more sociable and affectionate. Thank you.
Thank you, Miss Rajee Varghese ma'am, for sharing of your valuable words about motherhood challenges in breastfeeding. Thank you, Dr. K. Memchoubi ma'am, for contributing valuable input toward motherhood challenges on unemployed mothers. Thank you, Miss Sneha Sankpal ma'am, for sharing valuable words for motherhood challenges on working mothers. Thank you, Miss Rucha Bade ma'am, for sharing your valuable contribution for motherhood challenges on unemployed mothers. Thank you, dear participants, for joining with us for today's session. If you have any queries, kindly put it in the chat box. Thank you once again.